Hi, my name is Nathan Brown. I'm 43 years old, and I've been experiencing homelessness now here in Boston for about 3.5 years. First and foremost, we're humans, and we're people, and we have families, and we have past, and we grew up in homes. You know what I mean? A lot of us didn't choose to be homeless. The stigma has to be eradicated on so many levels for so many different things. But until people start looking at the homeless issue as a human issue, you know, it's going to be totally squandered.
Hi, I'm Sherry. I've been homeless for about 7 years. So what are you going to do to ensure that these homeless people actually get housing? You know, I mean, it's huge. There's so many obstacles, barriers, whatever you want to call it. So what are you going to do to help the homeless get housing?
So I'm Devin Hartley. I'm 38-year-old male. Originally from Baltimore, Maryland. I came to Massachusetts. I've been up here for 10 years now. With homelessness, I've experienced homelessness, I can honestly say, since I was a young man around the age of 16. There's a lot of homeless people that these houses can be occupied by these homeless people. I don't understand why a whole block full of vacant houses is not occupied, and we have so many people sleeping under the bridges and sleeping on the streets and things of that nature.
Hi, my name is Denise Reed. I am from Pine Street area. I am 47 years old as of next week, July 27, and I just want to talk about my experience being homeless and the things that I've been through. And I've been homeless for 4.5 years, but you know, my question is for the improvement of the shelters, of more access of getting into them, and instead of turning people away, because it's unfair. Like myself, I experience sleeping outside, especially on days that's cold, and also I just want to say, can y'all at least improve more food, good fooding, and more cleanliness as well, because we are human as well, so that's the things that I want to talk about, and let you know that I've been through this for the last 4.5 years, and it's been a long trip, and I thank God that things are coming together for me, and I'm grateful for everything and the people that I met and the struggles. I just want to know that, how can you help us? We just want to live as well. Thank you. Bye-bye.
My name is Dennis Watkins. I'm 61 years old, and I've been homeless off and on for the past 20 years. I would like to know what would your policies on curbing the violence in the city of Boston. That's all of a sudden it's all exploding, daylight shootings and stuff like that.
What are you going to do for safety for men, women, or anybody who's been a victim of rape? What can you do? These people need everything. Everything. Cell phones, mace. There's just so much involved. Food. Public restrooms, so they don't have to sit in their own feces or urine, and a lot of people just need a little help.
My name is Mrs. Mary Elizabeth Hutchison. I am 65 years old. I'm a senior, and I've been here in Boston since 1994. So I've been around for quite a lot of years, and I've been I've had places to live, and I've been homeless, and I'm finally getting my life together and getting myself straightened out. What will you do to make life better here in the state of Massachusetts for the mentally ill and for the less mentally ill? Are you going to help them? Are you going to put them someplace where they can get the proper care that they need and the medical help that they really need?
Hi, my name is Mayoral Brown. I've been homeless since I was 17, yes. And it's been a struggle ever since. And yes, and can you do more physical and mental health for the homeless? That'll be very, very helpful in our ordeal in times of need.
My name is Todd Zamachi. I am 42 years old. I've been basically homeless For about 3.5 years. The homeless are suffering, the real homeless, that want a better life.
Good afternoon, everyone, and welcome. I'm Marcela Garcia of the Boston Globe. I'm an opinion columnist and member of the Globe editorial board. I'd like to begin by thanking our sponsors, our presenting sponsors, Boston Healthcare for the Homeless, Pine Street Inn, Project Place, and St. Francis House, as well as our co-sponsors, Bridge Over Troubled Waters, the Downtown BID, New Market Business Association, Rosie's Place, and Women's Lunch Place. The Boston Coalition for Homeless Individuals presents this candidates forum focused on pathways out of homelessness. Homelessness is a painful and traumatic experience that too many of our neighbors are suffering through. This is a crucial issue in Boston, and it connects to healthcare, housing, employment, technology access, and other sectors, all of which we'll get into today. We're here to better understand precisely how these candidates for Boston mayor intend to address homelessness in this city. So we're going to begin with introductions. Candidates, you're going to have 90 seconds to respond to all the questions, and you're going to have 90 seconds to introduce yourselves and your approach to tackling homelessness in Boston. We will proceed with alphabetical order by last name. That means that John Barrows, you will start. And please let me remind you to stick to the time, the 90 seconds. We have a lot of questions, all of which were informed by the individuals served by this organization. So we really, really want to respect the time here. So John, with that, you're on.
Thanks, Marcella. I want to first thank the organizers for putting together this forum on such an important issue in Boston. I want to thank you for starting with Voices That Matter, with real live people who are talking about their real life experiences. It's important, and we have to recognize that everybody deserves safe, quality, and stable housing. Stable housing leads to better social outcomes, health outcomes, academic achievement, and frankly, quality of life for individuals, families, and communities. I spent nearly my entire professional career working in community to help organize and strengthen our neighborhoods by building all types of housing at all levels of affordability. Earlier this month, I had the privilege of visiting St. Francis House, where I met a young man named, I forget his name. The young man is originally from Fields Corner, and he's been clean and sober for the past year, coming out of jail. And he's doing everything right. He's enrolled in Benjamin Franklin Institute in the construction management program, and his instructors and the staff there are being supportive, and he feels he's going to get a certificate. To support his studies, he enrolled in the iCater program at the Pine Street Inn and works part-time with real professionals. And then he spends his free time at St. Francis House studying. And then at night, he has to stand in line for shelter at Mass and Cass, surrounding all types of temptations. We need to make sure that people like him have housing that they need to get back on their feet.
Thank you, John. Councilor Campbell?
Thank you, Marcella, and thank you to all of the organizers, and thank you for starting out with the voice of those who are living with the very issues we're talking about, because they also have the solutions. I've been on the council for the last 6 years, representing largely Dorchester, Mattapan, a little bit of Jamaica Plain and Rosendale, and have been working on these very issues of housing stability, including with those who are homeless, also on issues of dealing with substance use disorder, economic stability, domestic violence. All of them are intersectional. My leadership has always been about, one, not only centering and lifting up those who are living the very issues and making sure they're at the table to inform the policies. And even with my current mayoral policies, that has been the case, but always dealing with these issues with a sense of urgency and action, and of course, in partnership with the providers. Right now in the city of Boston, no one should be homeless. No one should be housing insecure. When I jumped into the mayor's race back in September, I stressed that on the one hand, I have been blessed to grow up in the city of Boston and to really receive everything, the possibilities, frankly, of this city, a great education, access to opportunity that allowed a poor girl from Roxbury to go off to college and to become a success story. My twin brother, on the other hand, did not receive those same opportunities and died while in the custody of a state prison. But the best thing about our city, if we tackle these inequities, including with respect to homelessness and all of the other issues as well, that we have everything it would take to close these gaps. We have everything it would take to ensure that every single person in the city of Boston has access to housing, mental health supports, economic opportunity, and so much more. That's what my candidacy is about, and that's what my leadership is about. Really happy to be here to answer your questions.
Thank you, Councillor Campbell. Councillor Sabi George, you're next.
Thank you, everyone, for bringing us together today to have this very important conversation. And just because I know he's tuned in, I'd like to say a quick hello to Monsignor Frank Kelly, who is a founding member of the Pine Street Inn. And I wish you, Monsignor, a very speedy and safe recovery. I've spent a significant amount of my time on the Boston City Council focused on the issues of homelessness, mental health, and substance use disorder. As the founder of the Council's Committee on Homelessness, Mental Health, and Recovery, I have a deep understanding of the reality of homelessness in this city. And I'm dedicated to finding substantive, meaningful, and long-term solutions to the challenges our individuals who are experiencing homelessness and our families experiencing homelessness face every day. I've worked for many years listening to and working with family shelter providers, those with lived experiences, and community stakeholders on this work. These conversations, these meetings, this effort has shaped my ordinance that I passed on the City Council to end family homelessness here in the city of Boston. And while I'm incredibly proud of this legislative accomplishment, I'm even more proud that we've done this work together. And that's what I'll do as your mayor. I will listen and learn to those around me who have had lived experiences and are doing this work every single day. You must drive the agenda. I'll bring those experiences from my city council efforts to the mayor's office. We have a lot of work to do, and I look forward to doing it in partnership with all of you. Thank you.
Thank you, Councillor. Acting Mayor Janey.
Thank you so much, Marcella. And I want to thank all of the organizations that are sponsoring this important discussion. And I certainly want to thank the many individuals who shared their personal stories. As the first woman mayor and the first Black mayor for our city, I have a life experience that is very different than my predecessors. And I bring my lived experience to this work every single day. And that lived experience includes housing insecurity. I know what it's like to grow up in subsidized housing, to be a single mom and dependent upon a Section 8 voucher to make ends meet. I also know what it's like to stay in a shelter for a week, a homeless shelter for women and children, as I experienced housing insecurity for much of my life, like so many residents, even those of us who have apartments who are one paycheck away from being homeless. We have to do more in our city, and I've been proud to lead in this work as mayor on the city council and throughout my life, throughout my career, issues that help stabilize our communities and ensure that we all have a fair shot. That includes housing. This is an issue of dignity for many folks. This is a basic human right. This is how we stabilize our neighborhoods and ensure that folks have access and opportunity to jobs, to schools, to so much more that comes with housing. I look forward to a great discussion, and I thank everyone again.
Thank you so much. Councillor Wu.
Thank you, Marcella. Thank you so much to all the organizations, leaders, and partners who have spent time creating the space for us to be very intentional in our conversations addressing a community and a set of issues that is pressing for our city, especially after the pandemic. I've had the privilege and honor of serving, representing the entire city as an at-large councilor for 8 years now. And in fact, the very first push that I'd had on the council was to go and visit every single emergency shelter around Boston to understand what it meant to face homelessness. This came about in my first run for office because I tried as a nobody who nobody knew to find where people were in high traffic areas like T stations and bus stops and public parks, where I would always get to have deep, long conversations with individuals experiencing homelessness about the extra burdens that it meant for health, for job access, for childcare. And so I've been proud on the council to be pushing to see those experiences changed with policy. I am first and foremost a mom. I'm in government because I know how much this matters, how urgent our policy is, as someone who has lived with a mother struggling with mental illness and raised my sisters through that, and now raising my own 2 kids in Boston. When I am at Mass and Cass or at Rosie's Place or at so many of our amazing resources, I see my family stories there. And I'm going to fight as hard as I can every day to make sure that we are acting urgently for that foundation for health, jobs, and quality of life for all.
Thank you. Thank you, everyone. So before we begin, and like I said earlier, I want to highlight that each of the questions we are asking this afternoon have come from numerous interviews with the guests of the partner organizations. So the first question will go to all of the candidates. We have heard each of you over the course of your campaigns discuss the need for permanent supportive housing in the city. Those experiencing homelessness require deeply affordable housing, which means at or below 30% of the area median income. And they need wraparound services to support any physical or mental health needs. How are you specifically going to increase the development of this housing? And what goal can you commit to for the number of new units to be built? And I like to remind the candidates in their answers, we are looking for as specific of a plan as you can offer. So by random assignment, we're going to have Councilor Sabi George go first.
Thank you very much for the question. Need to find my unmute button. I think when we talk about the work to make housing creation and stability more, or in housing and access to housing more accessible, it is so important that we are very much focused on aligning our resources as a city. We need to make the housing search process less burdensome, and we need to make sure that we are creating a clearinghouse, a place where any individual, any family who's experiencing homelessness can find access to those affordable units. We need to also make sure that we are working in partnership with our housing authority to make the system, again, more accessible. If our families, our city's residents aren't able to interact and interface with the system, they are going to be unable to access that housing. We know the tremendous wait list that exists through our housing authority, and we know the important work around providing not just the housing unit, but the supportive services with that. So as we work to build and streamline the process to build more affordable housing, we have to make sure that there are entry points along the continuum of housing search for our city's residents who are experiencing housing instability and homelessness. I've done that work as a city councilor through collaboration and will continue to lead on this issue as mayor of the city.
Thank you, Councilor. Acting Mayor Janey.
Thank you so much for this important question. We have done a lot already in my tenure over the last 4 months under my administration, including investing right away in a rental relief fund of $50 million for folks who are experiencing housing insecurity and in danger of losing housing. In terms of supportive housing, there is currently hundreds of units being planned for in the pipeline as we speak. Already, in the permitting process being built, some of which we are moving people into right now. This is a critical issue. This has only been made worse by COVID. This was already a challenge before the pandemic, and we have seen an uptick in terms of the number of people who need housing. There have been a number of investments, including working with landlords who want to be generous in their support and helping them provide housing. There's been $3.5 million of supports in housing the homeless to prevent displacement. So there are a number of things underway currently, and we need to scale that up because the pandemic is still with us and it is continuing to exacerbate a challenge that has already been here long before the pandemic. In terms of specific numbers, we need to get into the thousands of units. And we have to recognize it's not just individuals, that it's families that need supportive housing, individuals who are dealing with substance use disorder who also need housing. And that work is currently underway and we're scaling it up into the future.
Thank you. Thank you. Councillor Wu?
Thank you. We have fallen far short in terms of growing our city in a way that matches the accessibility at the income levels of what's needed, as well as the type of occupancy that's needed. In a city that is growing so much, we need to continue to focus on ensuring that we are targeted and using city resources and really taking responsibility at the municipal level for supportive housing. Our partners who have helped put together this conversation today have been doing so much. And I want to thank the Pine Street Inn for a big push to shift from emergency shelter to supportive housing and the impact that that has had in our city. I know that the plans are laid over the next 5 or so years to get from the 850 units to closer to the 1,000 units of supportive housing. And city government needs to be step by step a partner in ensuring that we are doing that. I've committed to, within the first 100 days of my administration, analyzing every single city-owned parcel of land and building, many of which are underutilized right now, to be able to immediately create supportive housing. When we cast our goals, for example, the 69,000 new units that were due for 2030, we have to be specific about breaking that down by neighborhood as well as by income level. And Boston needs to lead the way in not just creating more affordable housing, but stabilizing our residents and piloting new financing mechanisms so that we can help residents stay in these homes and build up equity over the long term.
Thank you. Councillor Campbell?
Thank you, Marcella. I've always led from an intersectional lens. And so as mayor, that wouldn't change. Really implementing a housing first approach to ensure that we are building housing, supportive housing, permanent housing for those dealing with homelessness, but that also means survivors of domestic violence, our veterans, returning citizens, people with quarries. I think the stories that were lifted up at the very beginning of this program really stressed a couple of things. One is not only what you're going to do, but what have you done? I have been on the trail since September, really stressing that I have a track record on accomplishing these issues. I started the vacant lot initiative in the city of Boston. We are now activating hundreds of city-owned lots. I committed to, as mayor, of activating 100 city-owned lots within my first 100 days as mayor. One of those lots right now is being activated to deal with the issue of homelessness and to create supportive housing. My first piece of legislation was a Community Preservation Act. It's been generating $20 million every single year, including for affordable housing. I would make sure a large percentage of that goes towards housing that is permanent and supportive housing. In addition, I fought for Bridge Over Troubled Waters, right, which is the only organization serving youth who are homeless, for them to get funding. I would continue to expand access to these organizations, including Rosie's Place and others, to get the resources they need. I have a track record, but most importantly, a plan to get it done. And lastly, workforce development also has to be a part of this conversation. Economic stability is critically important in every supportive housing conversation.
Thank you, Councillor. John?
Thank you, Marcella. Marcella, I'm the only candidate in this race that has actually built housing, built deeply affordable housing, built transitional supportive housing for homeless in partnership with other agencies. And I'm proud to have been a part of the Walsh administration that has housed over 15,000 unhoused people since 2014, including 1,000 chronically homeless people and 1,300 homeless veterans. As mayor, I would promise to double that within the first 4 years. We have $500 million coming to the city of Boston, and I've pledged over $200 million going to housing, and a lot of that going to transitional affordable housing. That means we can, in fact, double the 15,000 to 30,000 within the first years, including focusing on chronically homeless people and our veteran population. It is also clear that it's not just about the housing, it has to be about the supports. We heard from those who testified before we started this forum that they said food was important, safety important, health services, mental health services important, as they talked about their stories. So we need to make sure that we're partnering in building these houses. We're partnering with those who are providing these services in our communities so that these housing can be supportive truly with the wraparound services that they need. Thank you.
Thank you, John. Many of those experiencing homelessness have few places to go during the day, to rest, to enjoy company, and access resources. Over and over again, in the interviews the coalition conducted with guests, they mentioned wanting more of such spaces. including one individual who we will hear from now.
Hi, my name is Nathan Brown. I'm 43 years old, and I've been experiencing homelessness now here in Boston for about 3.5 years. What are you going to do to create safer spaces for individuals to be able to just breathe, access water, bathrooms, wash your laundry, but more importantly, access community resources that are already there.
Nathan's question is going to go to all of the candidates, and we're going to begin with Councillor Campbell.
Thank you, Marcella, and thank you, Nathan, for the question. It's a critical one, and I've heard the same. I heard it when I was doing walkthroughs with residents who were experiencing homelessness, also substance use disorder in the area of Mass Ave and Melnia, and of course, other parts of Roxbury and other parts of the South End. This is a major crisis right now that we're seeing in the city of Boston. It's the opioid crisis coupled, of course, with the homelessness crisis, and it's on full display in that area. And it continues to get worse. Even as we're sitting on this Zoom, I was fielding calls this morning about more needles in the parks, more needles near people's, our students and young people's schools. I grew up on Mass Ave. I grew up poor in the city of Boston, didn't have much of anything. And we never had to deal with any of that. We did not have needles in our parks. We did not have needles on our streets. We definitely didn't have to deal with folks and bodies on the ground, and you didn't know if someone was dead or alive. So I put out a plan a long time ago on how to create an effective response and specifically safe spaces. If we were able to create immediate infrastructure, bathrooms, safe spaces for folks dealing with COVID, we can absolutely do the same with folks dealing with substance use disorder and homelessness, including temporary housing spaces and temporary shelters. That was a part of my plan that I put out in January. I pushed the previous mayor, I'm pushing this acting mayor to implement those ideas and stressing that this is a crisis that if we do not tackle right now, it will continue to get worse. And I refuse to accept that the next elected mayor has to grapple with these issues that these residents are dealing with right now.
Thank you, Councillor. Councillor Sabi George.
Thank you for that question. As we think about our individuals who are experiencing homelessness, living unsheltered on the street, being in places near and around our shelter system, but also near and around our public spaces and places across our city, we need to do more to support these individuals. We also need to do more to support our families who are living in shelter, living in congregate settings, living in scattered sites across our city, living under very restricted rules and regulations. We have work to do to make sure that these spaces, all of them, are much more conducive to creating both a setting that is supportive, but also a setting that truly does respect and treat with dignity the individuals and the families, the young people and the older people who are experiencing homelessness and really responding to their needs. And we need to do that certainly in our shelter system, certainly in the programs that we support, and in partnership with the nonprofit organizations who are both providing those support services, those shelter opportunities, and the outreach work, and meeting individuals who are in crisis, who are housing unstable, who are living in shelter and on the street, meeting them exactly where they are to provide those services. And that simple humanity that we must treat people with is something that we as a city, if we truly value that, and I do through my work on the council have demonstrated that value, we need to fund it. We need to access the ARP money in a significant way to do this work. All of it in a comprehensive way, supporting a true continuum of care for individuals in crisis.
Thank you. John?
Thank you, Marcella. It is critical that we create spaces that treat people with respect and dignity and that value people. That's why it is super important that we work with the Boston Medical Center, the libraries, and other buildings in the area of Massachusetts Avenue and Melanie Cass to reopen bathrooms and make sure that people have spaces that they can go to and spend during the day and be supportive. I was proud to be part of the Walsh administration when we decided to expand and create a true engagement center a place where people can go to, a permanent location, in fact, in consultation with the neighboring community. It's critical that we support more of those locations, support organizations like the St. Francis House that has different places for different residents, spaces for women only, spaces for those who are in recovery, spaces for those who want to be able to study and improve their skills and try to find work. They have mailboxes available, housing and laundry rooms. It's important that people have the basic necessities that they need to have a decent life. And as mayor, I would promise and commit to expanding those kinds of spaces around our city.
Thank you. Councilor Wu?
Thank you. I'm really grateful to Nathan for this question. We know that the organizations doing this work are showing us the pathway and laying out the model for what it means to meet basic needs and provide that dignity. When you walk through St. Francis House with Karen and you can see all the places where all the services under one roof, just an elevator ride away, from the food pantry to job search to counseling to applying for housing. When you are in Rosie's Place, where I had the pleasure and privilege of serving on the board for many years, to see a one-stop shop for legal services, for help with any questions that might come up, issues with children and connections with schools, that type of eliminating the barriers, whether it is physical barriers so that our residents all across the city can enjoy public spaces and have the transportation to get there and to be able to have activities and programming and social networks during the day, or those other barriers that are bureaucratic in terms of going to this agency versus that one and jumping through hoops to connect the dots on what families need. We can do better in terms of supporting the organizations that are already on the ground doing this work. I fully support efforts to increase the capacity of St. Francis House and some of our other partners and making sure we are adding housing on site as well. And to have the city of Boston lead the way when it comes to removing barriers, such as providing free transportation, such as providing housing that is supportive and stable for all of our residents.
Thank you. And Acting Mayor Janey.
Thank you so much. I want to thank Nathan for lifting up his question and putting out there. I think we have to start with the values piece. We have to make sure we are doing everything we can to remove the stigma of people who are unhoused, who need support. And the reality is, so many of us who do get to go home every single day are very vulnerable to being in the same situation. And so we've got to make sure that we are treating everyone with dignity and respect and understand that this is about people's humanity. So that's number one. For too long, there has been this stigma. In terms of safe space, so critically important. Everyone deserves to be and be free and to be able to live in safe space. And that means accessing everything from our community centers in terms of city property, community centers, libraries, doing more with our schools to really make sure that they have wraparound supports and services, particularly for the number of families that are homeless. And we also have to understand that people who are unhoused live all over our city. This is not something that is just left to a particular intersection that we like to lift up. This is something that people are dealing with all over. Finally, we have to make sure that we're doing more to support those on the ground who are doing the work every single day, many of whom have organized this forum, many of the different shelters and organizations who are leading the way. We've got to do more to lift them up and expand the opportunities for unhoused individuals to connect to the many services that they need.
Thank you. This next question is for Acting Mayor Janey and Councilor Campbell. We have heard from both of you how central access to employment is for Bostonians. How will you invest in workforce development training and incentivize employers to see individuals experiencing homelessness and returning to the community from incarceration as a solution to the workforce needs that employers are currently facing? And Acting Mayor Janey, you can go first.
Thank you so much. Again, very important. If we want people to be successful as they rebuild their lives, we've got to make sure that other things are being put in place, particularly career, access in terms of their license, to be able to drive if they choose to drive, and certainly dealing with food insecurity. First and foremost, bringing on a cabinet level position, a chief of labor and workforce development that will help in workforce all around, but specifically to this population, particularly those with CORI, have already engaged in conversations beginning with labor unions as well as the sheriff of Suffolk County around how we do more with folks who are behind the wall and really prepare them as they come out in terms of reentry, and strengthening the partnerships with labor organizations to do more apprenticeship type programs with this population. If we want people to be successful, we've got to set them up for success. And we can't just assume that we're going to open the door and say, be on your way. We've got to make sure that they are connected in a meaningful way to supports that will help them rebuild their lives and be successful in the workplace. The other thing are the nonprofits who are already working in this space, to do more to partner with them and to expand the programs that they have, particularly around soft skills, around making sure that people have access to the clothing that they need, the interview skills, helping to build their resume. All of that work is essential if we want to see people be successful.
Thank you. Councilor Campbell?
This issue, workforce development in general, is near and dear to me, and it's going to be critical coming out of COVID because we're seeing, of course, higher unemployment rates, particularly amongst those experiencing homelessness, those in our immigrant communities, and those in certain neighborhoods in the city, including in my current district, which is largely Dorchester and Mattapan. And it's also near and dear because of those who, like you said, returning citizens. Most of my life has been connected to loss, frankly, when it comes to the criminal legal system. And I talk about the fact that my mom died in a car accident going to visit my father, who was incarcerated at the time. And my father was incarcerated for the first 8 years of my life and gets out of prison when I'm 8, and then he suddenly passes away when I'm 19. The reason I do this work is my twin brother died while in the custody of a state prison. So I've always been intentional as a counselor in making sure that those who have quarries or coming out of houses of correction or Department of Correction have access to workforce development opportunities. A few things I would do as mayor is continue to build upon that council work. One is greater investment. It is critical. City Hall can start with itself, diversifying our own employee base to allow folks with quarries to have these jobs, to allow folks who are dealing with other issues or disabilities to have these jobs. Digital divide. We cannot have a successful conversation on workforce development opportunities without investing in closing the digital divide. Workforce development opportunities for some populations need to be stipend. That is critically important. And with these federal dollars coming in, we can make that happen along with greater partnership with our employers in the city of Boston. We have not maximized those partnerships as of yet.
Thank you. This next question is for the remaining three candidates. The rate of fatal overdose among people experiencing homelessness in Boston is magnified. It is 12 times higher than the general population. Indeed, at Boston Healthcare for the Homeless program, overdose deaths account for 1 in 3 deaths in the fentanyl era. In addition to providing compassionate and destigmatized care, supervised consumption facilities have been proven to decrease overdose mortality and increase engagement in addiction treatment. Councilor Wu, John Barrows, and Councilor Isabi George, you have each mentioned your teams have been looking into safe injection sites and assessing their benefit, but have differing opinions. Would you support supervised consumption facilities in Boston? And we can begin with you, Councilor Wu.
We need to take every possible step to save lives, and the data is clear. The medical community, the experts point to this as an intervention that can save lives in a moment of urgency and growing need. Not only has the rate of fatalities increased from overdoses, but we know it is a disproportionate impact that exacerbates racial injustices, that the increase during the pandemic for the overall population was very disproportionate for Black men experiencing overdoses in Boston. And so this is a moment where we have to follow the recommendations of our providers and the experts in the area. We will work hand in hand with our community partners and stakeholders because the siting of these facilities is a very important conversation. about the locations that can connect to other services and that match with our goal of ensuring that there's access not just in one location of the city, but making sure that we are removing barriers to access and treatment everywhere and bringing a higher urgency to how we are addressing the overlap of substance use, mental health, and homelessness, not just at Mass and Cass, but across all of our neighborhoods and regionally.
Thank you. John?
Thank you very much, Marcella. Let me just be clear and direct. I support safe consumption sites that are planned and cited as a part of continuum of care. The evidence and proof that they are effective in reducing harm and deaths are clear. It's important that new safe consumption sites are created in tandem with additional wraparound services for people struggling with substance abuse disorders. We also need to recognize the adverse impact that the sites have on the quality of life of surrounding communities. We need to locate them in areas that don't compromise other community members' safety. And we need to have a thorough community process and conduct an impact assessment to ensure that any impact on the community are planned for, mitigated, and in fact are equitable. Equitable access and equitable impact. COVID-19 has strained our communities like never before. And our city's clearly hurting, but at the same time, we need to address the inequities in the hurt because there are some communities that are more vulnerable than others. The preliminary data released by the Department of Public Health of Massachusetts show that Black men have seen the highest number of opioid deaths in 2020. I think the overall overdose deaths in Massachusetts rose 5% in 2020. But Black men in Massachusetts saw a 69% spike in overdose deaths over that last year. So we need to make sure that we are being equitable and fair in how we treat the vulnerable populations.
Thank you, John. And Councillor Savvy George, please.
This is a question that's come up for for all of us for a number of years, and certainly since I took office in 2016 and started the Committee on Homelessness, Mental Health, and Recovery. I have visited safe consumption sites in Toronto and Vancouver and have done a great deal of work, both having a deeper understanding of both the benefits and the implications of safe consumption sites and safe injection sites in other places. I think first and foremost, it's important to note that safe injection and safe consumption sites are illegal by federal standards and federal law, and medical and healthcare providers, licensed healthcare providers, will not be able to participate in their operation. And we also know that those suffering from substance use disorder aren't going to travel long distances to utilize safe consumption or safe injection sites. They, in order to work and work effectively and appropriately, they need to be located in very close proximity to one another and spread out across the city. In fact, Toronto itself has 60 safe consumption and safe injection sites. That investment will cost millions of dollars. And I would much prefer to take those dollars and invest it in long-term recovery services. We think about the needs today of those that are dealing with substance use disorder and stimulant disorder when we think about the ever-changing drugs on the street and the challenges that those that are dealing with substance use and stimulant use disorder are facing. We have other work to do, and that's what I'm committed to.
Thank you. Now we're going to change it up a little with a bit of a lightning round question. The City of Boston and the state have been engaged in a planning process for the development of land on the Shattuck campus. A number of proposals have been discussed. Do you support the development of permanent supportive housing on the Shattuck campus? And please respond with a yes or no, and if you wish, a few words of context, but not too many. And we're going to begin with John.
I will be brief. Yes, I do.
Councillor Wu, please.
We need to have a full conversation with the state in terms of all the parcels. And so I support and will commit to urgently increasing the number of supportive housing units on city-owned land and public land. But we need to have one conversation about all the parcels at play here.
Acting Mayor Janey?
I support more supportive housing indeed, and a much more comprehensive approach in terms of how we get at that number.
Councilor Sabi George?
The answer for me is yes, and we can continue to have those other conversations around the other parcels of land, whether state or city owned. But for this question specific to the Shattuck campus, I support permanent supportive housing on that property. And I think it's important to note that we can discuss other parcels, additional parcels, whether owned by the city or state. But to answer this question, the answer is yes.
And Councilor Campbell, please.
Yes, and I have received a lot of correspondence on this very issue. The majority of correspondence I've received from residents supports supportive housing on the Shattuck as a way to address the pressing public health crisis of opioid crisis that we're dealing with in the city of Boston. And of course, I've received emails and correspondence on ways in which to have a conversation about the other concerns related to that parcel.
Thank you. Next, we're going to hear from another neighbor of ours who has taken the time to write out a question for you all about what innovative ideas you have to address homelessness in Boston. She will be reading it to you all now.
So my name is Asuka Manning. I'm 25 years old and I've been experiencing homelessness for the last couple of months. As cities like Boston become more populated, the resulting gentrification becomes the last nail in an increasingly inescapable coffin. Lifelong residents suddenly find themselves without the funds to pay their rising bills, and soon enough they are without a home too. Homelessness is an issue that affects people from all walks of life. Homelessness is an indiscriminate and pervasive obstacle to a healthy and happy life, and it requires a comprehensive and lasting solution. How does Boston fare in combating the homelessness epidemic? With steadily rising rates of homelessness, it is clear the current solutions are vastly ineffective. What are some new ideas or innovations that could tackle this crisis differently?
And by random assignment, Councilor Campbell, we would like to hear from you first on Asuka's question, please.
Thank you so very much. I appreciate the question and appreciate, I couldn't hear her name because she was masked up, Marcella. So what's her name?
Asuka, A-C-U-K-A. I hope I'm pronouncing it correctly.
Thank you for the question. It's important to acknowledge people. So a few things. One is, I think already we've been talking about the homelessness issue in the city of Boston is at a crisis. And it has been for some time. You know, homelessness in Boston has gone up and actually went up 10% in the year before the committee that Councilor Sabi George used to chair was dissolved by our acting mayor. It went up 10%. And since that committee was resolved, it has continued to get worse. And I always lift up Madison Cass because it is the epicenter of where you can see it get worse. Literally, as we're sitting on this Zoom, more tents are going up in the community. So there needs to be an immediate response right now. And I will tell you, hearing these resident stories is painful because no one should have to search for a bathroom or a temporary space or temporary shelter when you think about all the resources and the incredible providers we have in the city of Boston. Short-term solutions are necessary. Long-term, we can do creative things like expand access to funding, greater investment with the millions of dollars coming from the federal government, activating those city-owned vacant lots, and there are hundreds of them for these purposes, coupling that with workforce development opportunities, mental health supports, and the wraparound services that so many providers already provide with greater investment. But the work needs to be done right now.
Thank you. John?
Thank you very much. I want to thank. Can you hear me?
Mm-hmm.
Thank
yes.
you. I want to thank Asuka for the question. And you know, it is important that we deploy strategies that preserve communities that are anti-displacement, and then that develop our neighborhoods in ways that we can take advantage of it. The people who live in those neighborhoods. That's why I spent 13 years of my life as executive director of the Dudley Street Neighborhood Initiative, working in community in a process that was led by residents to help improve our community and make sure that we could develop it, improve it without displacing ourselves. It is critical that government work with community to make sure that we are developing communities that work for them and not because we're going to come in and solve it for them. As mayor, I will create a fund that supports the capacity building of community organizations like community land trusts in order to acquire land and create more affordable housing and support our homeowners in their homes, our renters in their homes. It is important to also create home ownership opportunities for people who are looking for it, and also home real estate investment opportunities from community members who are trying to improve their communities through tools like a neighborhood investment fund that allows people to not only decide what happens in their community, but to be part of the wealth creation in their community. Stable, quality, affordable housing prevents homelessness. We need to start there and be very, very strong in that area.
Thank you. Acting Mayor Janey?
Thank you so much, Asuka. You mentioned gentrification. In the 1980s, my family's home, my great-grandmother's home in the South End, we weren't able to keep that home because of gentrification in the 1980s. We see that gentrification happening all over the city of Boston. The neighborhood in which I live has seen housing costs go up by 70% over a 5-year period. This is a crisis, and we need to ensure that we are using every single tool in the toolbox to deal with this crisis. That means, yes, we have to look at IDP. That means we have to make sure that we are investing everything from the rental relief that I did in my first week to affordable home ownership opportunities for income eligible first-time home buyers, which I have tripled that investment, taking that down payment assistance from $10,000 to $40,000. We also have to look at land trusts. We have to make sure that community is involved firsthand, have a front seat to these challenges because they are mostly impacted by it. This is a challenge in so many neighborhoods all across Boston. We also have to make sure in that toolbox, we are lifting up certain communities. We know, and it hasn't come up yet, that the queer community needs housing that is specific to them. Trans women in particular are unhoused and experience a lot of violence in the street. We have to make sure that we're doing much more for our families, for our school children, and so many, our veterans who are also unhoused. And we need a comprehensive approach that looks at a number of strategies.
Thank you. Councilor Wu?
Thank you. I so appreciated Asuka's framing of the question as well, not just pointing out the urgent, dire need, but asking for innovative solutions and new ideas. So I'll give 3 big categories. The first is that we need to step into city power to do something about this. We're often talking about waiting for state or federal government resources to fund housing. We at the local level have the ability, have the dollars, have the financing mechanisms to take this on ourselves, starting with city-owned land and making sure that we are putting affordable housing wherever we can, speeding up the development of that housing by changing the rules and the zoning code and processes that tend to make it slower and more expensive. The second is we need to make sure that we are taking an intersectional approach. There's much more that goes into a family's life is adding to that stress and that pressure when it comes to what gentrification sort of pushes you over the edge of. And that's why pushing for fair, free transportation is so important. That's why pushing to break down the silos of how city government reaches people through a children's cabinet, focusing on schools as the entry point to accessing services across the board, through libraries and community centers as places where if we can just connect with residents, we can offer the full range of what resources the city has. And the third, and most important in some ways, is to prevent this from happening in the first place. Keep people in their homes, prevent homelessness. I'm the only candidate who's for stabilizing rents and making sure the city of Boston is fighting for the full power to not just build more, but stop displacement.
Thank you. Councilor Isabi George, please.
Yeah, thank you for the question and being very specific about asking for comprehensive and long-lasting solutions. But in order to get there, we have to, as a society, as legislators, as government officials, recognize that the problem exists. When I joined the council in 2016 and started the committee in partnership with former council president, Councilor Wu, we started that new committee on homelessness, mental health, and recovery. And as Councilor Campbell mentioned, it is unfortunate that that committee was dissolved last year under the leadership of Council President Janey. It's very unfortunate because as we think about the crisis of homelessness and how it does intersect often with substance use disorder and mental illness, we have a crisis on our hand and we have to respond to it with a very specific and intentional focus. That's what I've done and continue to do, even aside from that committee no longer being in existence. Since 2016, working with shelter providers, both on the family side, on the individual side, we have outlined the short-term, mid-term, and long-term goals that need to be achieved in order to end homelessness in our city. It is certainly more than just housing. It's about support services, access to workforce opportunities, access to mental health services, a whole slew within that continuum of care and continuum of services. Through partnership with the Walsh administration, I was able to create the special commission, and in partnership with my colleagues on the council, we passed this. We hired someone who will focus on this work as a city. We need to continue that focus going forward.
Thank you. This next question comes from the business community in Boston and is for Acting Mayor Janey, Councilor Savvy George, and John Barrows. Homelessness is an issue that takes its toll on the broader community, not only on those experiencing homelessness. From neighborhoods that are more industrial to those that blend business, tourism, students, and residents. This is a quality of life issue for everyone. What will you do to ensure that the needs of all these constituencies are met that goes beyond displacement and creates a path out of homelessness for those living in shelter and outside? And we're going to begin with Acting Mayor Janey, please.
Thank you so much. This is important that we certainly hear the issues around quality of life from our neighbors and certainly our business community. And all of that, we can do more to recognize, again, the humanity of people who are unhoused and who are dealing with a variety of issues. This is not an either or. Oftentimes, I think we approach this as it's one or the other, but it isn't. We need to do both. We need to make sure that first and foremost, we are removing the stigma and that we are helping people who are unhoused get supportive housing, transitional housing that leads to permanent housing. My administration is working every single day to do just that. In terms of many of the businesses who are most impacted by this issue, we are working with them as well. I will lift up Newmarket. One of the things that we are working with Newmarket on is a new business improvement district. We are creating a bid there to support the efforts in that area because this is not an either or, this is an and both. Thank you.
Councilor Savvy George, please.
I so appreciate Marcella and anyone whoever asked that question specifically, that they are recognizing the quality of life issues that impact both the resident, the small business owner, the visitor, that those that are looking to move their business perhaps to the city of Boston, as well as the individual who is in crisis, who is living unsheltered, who is dealing with substance use disorder often, and who is also very often dealing with mental illness. We have to face these issues as they are quality of life issues for everyone involved, and everyone is very directly impacted. We think about the work that we have to continue to do as a city to support those that are most vulnerable. There's also a very specific need to focus on sort of all of the issues. An individual who is dealing with housing instability, who is dealing with homelessness, needs to make sure they have access to a high quality shelter provider, that the outreach workers, those that I have advocated for in my capacity as a city councilor, to have more tools, to have more resources, to grow in size, to increase the investment in the supports that we give them, that they have those tools to meet people where they are. Certainly this has a greater impact on our business community and on our city as a whole. That's why we have to make sure that the continuum of care and the continuum of services that are provided are done in collaboration, are done in partnership with one another. This is not one person's problem or one department's focus or effort. It has to be across a particular continuum. We have to break down the silos and do this work together.
Thank you. And John?
Thank you, Marcella. It's a very important question, and it's a question that my kids ask me when we drive by Melanie Cass and Mass Ave, when they ask, Dad, why are they still on the streets, or why does that person have a needle in their arm? What is that? Are they taking medicine? No, that's drugs. It's no good for them. Then why are we letting them do that? Why is this still happening? I live a few blocks away from that area. And it's disgraceful that we are still allowing for this kind of condition to exist in our city. We need to make sure that we address this. And I have been in the Newmarket business area as a former member of that association. I know what they're talking about. And in fact, it is a problem today. They're losing millions and millions of dollars in business because of the condition that exists in Mass and Cass. And, one business owner talked to me about their employer, their employee, their worker who showed up and was assaulted before she walked into the office and then quit because she can no longer go to work in that condition. This is horrible. The people who are on those streets deserve better services, and they deserve our care right now. What we need to do is make sure that we decentralize the services in that area so that we don't have it all spilling it out in the street. So I'm not sure about all the conversations that are happening about around the Shattuck. We need to make sure that we move these services out and provide permanent supportive housing right now.
Thank you. This next question is for Councilors Wu and Campbell. Many of our guests have mentioned that personalized care is what has been helpful in moving them or those they know out of homelessness. This can be applied to Mass and Cass. How will you work with each individual to provide them a pathway out of homelessness? What disciplines you might use or what types of entities will you engage with? And I'm going to go to Councilor Wu first.
Thank you. This has certainly been the experience of so many whom I have known and gotten the chance to speak with at our shelters across the city and who have moved out of homelessness, and experience in my family where having an individualized person that you can count on and who can help think through all the different considerations and make introductions is what can make or break that pathway. And so we need to start first and foremost with increasing our outreach and providing resources, investing in the staffing, the training, to make sure that we are actually connecting with individuals who are seeking treatment and who are gathering at Mass and Cass. Right now, when you are walking out there and in on the ground to see the state of who is where and how many people, it is overwhelming. And all we can do is just try to plug holes right now. More and more resources to sweeping our streets more often or picking up needles more frequently. We need to get at root causes, and that is connecting people to resources. We need to ensure also that we are fully staffing up the opportunities on the other side of that there are housing, supportive housing that's available. There's access to transportation. There's full connection with the database and the systems that so many of our providers are already using to ensure that we know the medications and resources and supports that each individual has. The city should be facilitating that as well.
Thank you. And Councilor Campbell?
Thank you, Marcella, for the question. And the personalized care and outreach is critical. I remember going to Rosie's place with my grandmother. We lived behind 1850 Washington. We were food insecure. We were poor. She would go there for a whole host of things, including supports, because she had just lost her daughter, my mother. And so there are a lot of providers already that are doing this personalized outreach, but who need greater resources, but who also need the city of Boston to take the lead. There has been a lot of talk on this Zoom and a lot of talk over the last six months or so around what we're going to do, what we're going to prioritize, et cetera. Right now, I can only do so much as a counselor. It is up to the acting mayor and the administration to take action. We've had too much talk. We have, even on this Zoom, we've talked about there is infrastructure the city of Boston can set up to ensure people have places and safe places to go. We've been talking about the need for more supportive housing. We've been talking about homelessness in the city of Boston getting worse. Employers in the area who are concerned about the safety of their employees. Right now, we need the acting mayor and the administration to step up and take action in response. I, along with a whole host of residents, have put forth incredible ideas. And there has been no meeting with the acting mayor and these advocates, no meeting with these providers. I put forth an idea around establishing a Mass and Cass chief, someone who is a public health professional, a responder unit that includes all of these stakeholders working in partnership. None of those has been acted upon. Even put out a 30-day challenge, still waiting for a response. Instead, this morning, I am dealing with calls from folks about some secret plans to possibly put more services in the Roundhouse Hotel instead of decentralizing services, adding more services to an area that is already overwhelmed. We need action and we need it now.
Thank you, Councillor. We're nearing the end of the forum, and this question actually addresses how you will get permanent supportive housing built in Boston. We know that segregating affordable housing into only a few areas in the city is unjust. To create community, neighbors from all backgrounds should live side by side with equal access to resources. However, there is not always broad-based support for building permanent supportive housing. How will you respond to NIMBYism and community pushback and actually get permanent supportive housing built for our neighbors who desperately need it? And Councillor Sabi George, we will begin with you.
No, thanks for the question. I want to emphasize that this question asks for a commitment to permanent supportive housing, and that we also need to ensure that we're not just building that housing, that we are truly making sure that it is permanent supportive housing. Because too often as a city, we make these commitments that are short-lived, and at a moment in time, it seems like it'll be here for a while. But making that permanent supportive housing permanent has to be a critical component of its future success. And I think as mayor, leveraging the power that that office has to make it possible is so important. We've done, especially over these last few months on the Boston City Council, led by many of our colleagues on the council, an effort to make sure that when we are building 100% affordable housing in this city, that we are fast tracking it, that we are making it easier to get that work done. As mayor, I am committed to making sure that that housing exists in every part of our city. Every neighborhood has to carry this load, has to be a partner in this work, and we need to do it together. And if it starts with leadership from the mayor's office, it is possible. We also need to work in direct partnership with our nonprofit organizations, many of them who are hosting this afternoon's conversation and forum, to do this work. The city has to play a leadership role, certainly has opportunities for funding and financial support and capital investment, but needs to work in partnership with those that are doing the work, especially around that supportive component. I've been supportive of these efforts to date and will continue to be as mayor.
Thank you. Councillor Wu, please.
I was going to give a shout out to the same efforts on the council, so fully agree there that we have the power to create the streamlined process and to make sure that we're pushing that through and eliminating so many of the barriers that have been used to hold it up. This gets to the need for a larger update to the zoning code and plan for the city, that when we are in a broken system where every single new development has to go through unknown, unspecified numbers of meetings and conversations and negotiations because there is no clear sense of what the rules are, we are all drawn into the additional costs of that soft process where that funding should be going to affordability. And we're also left with long periods of time when this is an urgent issue. The other point that we should push on that the city has the power to use is to really transform and empower the Boston Housing Authority to think about how we lean into this moment. We're past the days when there were large swaths of land available with federal funding to build all new developments, but we can take scattered site units off the market when there might be distressed properties or when there might be opportunities for the city of Boston to transform that, a unit here, a unit there, in partnership with our community partners, and keep that housing affordable, keep those renters and residents in those spaces. And then we need to make sure that overall, as we're planning our city, we are aiming for that vision of what we want together, how community fits together, so that we all have a stake in our shared destiny and aren't just thinking this as a shrinking pie.
Thank you. Councillor Campbell?
Thank you, Marcella. It's the idea of NIMBYism and various things. I've heard it just as a district councilor, because I represent largely Dorchester, Mattapan neighborhoods. Those are my largest neighborhoods that have over the years talked about not having a say, for example, in what comes into their community, being really concerned about having to bear the brunt of dealing with the inequities in the city of Boston. So grappling with those who are dealing with homelessness or substance use disorder or other issues. Right now, of course, we're hearing the same from residents in the South End and in Roxbury. I think it's really incumbent that a leader really stress that in the city of Boston, every issue that we are grappling with, we all as a city have to roll up our sleeves and deal with it. There's the good, of course. We are promising an incredible city with emerging industries, some of the best hospitals and medical institutions and providers in the world. We all celebrate that. When it comes to the inequities and closing the gaps to ensure no one is homeless, closing the gaps in terms of economic opportunity, closing the gaps in terms of safe neighborhoods, closing the gaps in our schools and our health disparities, of course, dealing with and addressing the public health and public safety crisis that we're seeing along Mass Ave and Milnia, we have to stress that's going to take all of us. It's going to take city employees, of course, working hard. It's going to take the business community. It's going to take public health professionals, those working in supportive housing. And so for me, it's always driving every solution with that in mind and stressing that we all have a stake in that for different reasons, but we all have a stake in that. And right now, the public health crisis outside of COVID-19 is the opioid crisis. All of us have a stake in addressing that issue right now and requires leadership from the city of Boston.
Thank you. And John?
And Marcella, thanks. And the framing is right. We know that, in fact, segregating affordable housing or concentrating poverty into a few areas in the city is unjust. And so we got to create ways for us to look at and have conversations about equity in access, equity in resources, and we've got to do it by having conversation. I am the only candidate that's been out there in the community and have had these conversations about where you cite transitional supportive housing. I've worked with partners that have helped put this forum together. I've worked with the Pine Street Inn in having conversations with communities to talk about what some of the concerns would be and what some of the issues would be. I have, in fact, then taken residents to transitional supportive housing sites to help, break down some of the stigma, some of the stereotypes, and to see that, folks who were previously homeless live and can live in places in ways that you can still keep a high quality of life. To see, in fact, those who might need, some supports can be there and not disrupt your neighborhood. But it's going to take leadership to show up in these meetings, have these conversations, educate people, and then talk about how we do it equitably and not in unfair ways, not in ways that we concentrate poverties or issues in our city.
Thank you, John. And Acting Mayor Janey, please.
Thank you so much, Marcella. Huge, important issue here. And I'm really grateful for all of the organizations, not just for putting on this forum, but for the work that they do every single day on the front lines. In addition to the initial $50 million right off the bat, day one, leadership from my administration, the work that we were doing to prevent displacement throughout the FY22 budget, another close to $40 million. That doesn't even include the hundreds of millions of dollars from federal support that we will have to continue to work on housing issues. That money is going to a number of things, including how we're dealing with public housing in our city, in desperate need of upgrades, making sure that we're providing more supportive housing. Right now in the pipeline, already hundreds of units. And folks want to have it both ways. We want it, but we can't put it here. Well, leadership shows we are going to have it. There was a very successful model that Pine Street Inn led, took an empty hotel, housed people who were out on the streets in transitional supportive housing who now have permanent housing. We need to replicate that model. When things work, we need to replicate it. That is what we're currently doing, in addition to the outreach and groundwork every single day, whether at the courts, whether in the streets, to make sure that folks who are housing insecure have the housing that they need. Thank you.
Great. Thank you. So the last question of the forum is a fun one. It's another lightning round, and candidates would like to hear, what is your favorite Boston tradition? And I'm going to start with Councilor Campbell.
My favorite Boston tradition. I have a few, but I would have to say, for a long time, it was going to the Nutcracker, because when I was at the Timothy Middle School, my best friend in the world was selected to be in the program. And it was the first time I had ever been to the Wing. So for a long time, obviously before COVID, it was going to see the Nutcracker at Christmas time.
Thank you. Acting Mayor Janey?
I have so many. Growing up, I used to love going to the Kite Festival in Franklin Park. I certainly love the Roxbury Homecoming, Juneteenth there. As a little kid, loved the frog pond. And certainly, of course, I love our sporting team. So.
Great. Councilor Wu?
There's so many festivals and parades I love as well, look forward to. I'll go hyper close to home for this one and say opening day of the Rosendale Farmers Market, which is always in my family a signal that summer is here. It shows the breadth of support, the connection between food and activities for kids and people from all over the city coming in, affordability with some of the programming and the ability to use SNAP bucks there as well. And so we always look forward to that every single year.
John?
So I'm going to go local as well. We have a local multicultural festival here in my neighborhood. It's called the DS9 Multicultural Festival, where there are all types of performances by residents of different cultures that are proud to come in, do their dance, do their song. Young people come in, they rap, they sing. It is really cool. But then you have the local businesses that come and sell food and sell, sort of crafts that they've created. And it's friendly. You can bring kids. I just try to stay away from the dunk tank. That's the only thing. When I go there, they try to get me to the dunk tank. So I compromise. I do a little face painting, and usually I can get away with it.
That's smart. And Councilor Isabi George, please.
It's such a hard question. My list is long. I'd say I love the Mayor's Cups competitions where we have neighborhood youth sports versus neighborhood youth sports. It happens all year round. It's really fantastic. And I've got to watch my kids participate in so many of those matchups. I also love the holiday tree lightings, which generally happen the 2 weekends after Thanksgiving. Those are so much fun. And they go across our city in all of our neighborhoods. Just this last weekend, many of us participated in the Mattapian on Wheels bike ride and fundraiser. And that was awesome. And then I think specific, especially to the conversation that we're having today, I've been able to participate and play a big role in the Winter Walk, which is a first Sunday of February. It's a short 2-mile walk through Boston, and the funds raised, 100% of the funds raised go to support efforts to end homelessness here in the city of Boston. And so obviously that's been important to my work on the council. So I think that's last and probably the greatest.
Awesome. Was that your dog?
Yeah, that was Astro.
He wanted to say something too and talk about his Boston tradition. Anyway, this concludes the forum, and we really like to thank the candidates for your time and for your insights. It was great. Above all, we want to take these sponsor organizations who helped put this together around such an important issue. Don't forget to vote on September 14th to everyone who's listening in, and thank you so much.
Thanks, everyone. Have a nice afternoon.
Thank you, everyone.
I'm totally against what they do down Mass Ave as far as allowing individuals to get high on notice, because people are still ODing and losing their life. It's not like they have made it any better with that being said. So I think y'all need to do something about that, bring that to attention to the masses of people to make it better.
I think that maybe people that are sitting up in their offices, the elected officials, should get out and into the street and meet more homeless people. Because if they're up there making policy on how to help homeless people, they should know at least know the people that they're trying to help.
If you want to learn more about the homelessness, just come and talk to us randomly. Whether they talk to you or not, there are some of us that will talk to you guys, like me. Come to me, I will let you guys know. Believe me, I've been homeless for a long time and I need help right now. I get $780 a month in SSI and that's still not helping. Not enough, so we need more. I personally need more revenue to get my own housing, like a room, just to support me for now until I get my own housing.
I think it's dangerous, it's unethical, it's unhumane. I think I wish I could just take y'all down there just to let y'all see it, know what it is. People sleeping in trashes, people going through trash. The aroma actually just going down there, you can smell the aroma of, you know, the disease and everything in the air. You just hearing it by third party. Me sitting here just explaining it, you get a small grasp, a shallow grasp of it. But when you see it, you'll have a totally different outlook on, you know, drug addiction and the homelessness and how it's affecting the community.
Can you give me a job?
There we go.
No, the big thing for myself, you know, I worked on and off in and around the homeless humanitarian human services thing on and off for the last 13 years. You know, I would very much like to be a part of the up and coming change that is hopefully going to be happening in and around the homeless situation. So, you know of any jobs openings? Nathan Brown.